Good afternoon, everybody. My name is Kelly McDonald. I'm the CEO of the National Rural Women's Coalition, and it is great delight that we open the Rural Women with Disability COVID-19 webinar. This is a partnership between Women with Disabilities Australia, the National Rural Women's Coalition, and we are funded by the Office of Women International Division. So thank you. Quick little housekeeping for us today is that we've got Auslan interpreters swapping every 15 minutes. Please just pin them at the top of your page by hitting the little icon up the top there so you can always see them, or there is captioning available for those who need that. Again, just down the bottom of the screen you'll see a little CC, and please use that. We are on a tight schedule today, so I will be keeping the time. You will hear a little tingle, and we will know that that will give a 1 minute warning to our presenters. I will also put that in the chat room so that they understand that they're on a one minute. We are also live on Facebook on Women with Disabilities Facebook page and the National Rural Women's Coalition Facebook page. If you are able to, please tag in your friends so as many people as possible can join us in this webinar. So now I would like to introduce to you Jody Barney, who is going to do our acknowledgement of country. Thank you, Jody.
Thank you, everyone. Hello, everybody. I would like to firstly acknowledge the traditional owners of the land where I am, Yorta Yorta country. I'd also like to pay my respects to elders, both past, present, and emerging. I want to acknowledge all the traditional owners of the land across Australia from where we meet today. I would like to acknowledge elders past, present, and emerging from around our whole country. I would also like to acknowledge the First Nations women who are watching, and our brothers, cousins, aunties, uncles who are also watching. And thank you for attending today's session.
Thank you, Jody. So the other people I would like to acknowledge that are joining us on the webinar today is Women with Disabilities Australia President Tricia Maloney, NRWC President Leonie Noble, the wonderful staff at Women with Disabilities Heidi and Jacinta, and our fabulous panellists, Tess Moody, Jody Barney and Stephanie Russell Farnham. And I also like to acknowledge our wonderful interpreters, both Therese and Brooke, and Sage, who will be doing our captioning. So thank you very much, and I'm going to now hand over to Heidi. Thanks, everyone.
Okay, thank you, everyone. Hi, my name is Heidi. I'm a staff member at Women with Disabilities Australia, and I'm just here to host today, and I'm now going to pass on to Tricia, who is our WIDA president and also a woman with disability living in Victoria and an advocate for our community.
Thanks, Heidi. Greetings, everyone. I'd like to start by acknowledging the traditional owners of the land on which we are each meeting and pay my respects to elders past, present and emerging. And I also want to acknowledge and thank all the women with disabilities, activists and advocates who have helped us get to where we are today. Tomorrow is the International Day of the Rural Woman, so it is timely that we are having this conversation today. My name is Tricia Maloney and I am President of Women with Disabilities Australia, which we call WIDA because that's a very long title. It is the National Disabled People's Organisation for women and girls with all types of disability. We are managed and run by women with disability for women and girls with disability. We represent more than 2 million disabled women and girls in Australia. We have affiliate organisations and networks of women with disabilities in most states and territories of Australia, and we are internationally recognised And more we are now connecting internationally as well. The issues for women with disabilities are the same wherever I travel in the world. All of our work is grounded in a human rights-based framework that links gender and disability issues to civil, political, economic, and social and cultural rights. It is important that we recognise that WWDA is determined to include all women and girls with disabilities in Australia, and especially those women and girls with disabilities who live in rural and remote regions. To help us to do this, we have developed our site, which is a website which we have developed to make as accessible to all women and girls with disabilities. Our site was created for and by women with disabilities through a national 2-year project led by WWDA. The project delivered on a vision that has been conceived by the WWDA community for many years. It's an accessible website that provides information about the rights of girls and women with disabilities in 4 key areas: leadership and participation, decision-making and agency, sexual and reproductive health, and the right to live free from violence. WWDA developed the website using an inclusive co-design methodology, and that means that the project consistently ensured that genuine, meaningful involvement and participation of women with disabilities in every aspect of the website's creation. This resulted in multiple benefits for the women involved and a website that is grounded in the diverse experience of women and girls with disabilities. And this included women living in rural communities. There is an Our Site report which provides a comprehensive overview of the Our Site website and how it was developed. And it had the input of over 100 women with disabilities across Australia. I suggest you visit our website, which is now in the chat box. I would like to thank the National Women's Regional Coalition for their support for women with disabilities who live in rural and remote areas, recognising that we are as much a part of their communities as other women. I would also like to thank the Federal Office for Women International Engagement Division for their support in bringing us together today. We are a very diverse community and we live in all parts of Australia. So now I hope that you can relax and enjoy listening to our speakers. Thank you.
Awesome. Thank you, Tricia. So now we're going to go on to each of our panelists. We have 3 panelists today who are each going to talk about their experiences as women with disability in rural or remote areas, and also how COVID-19 has affected them, which we all know is very topical at the moment. Our first speaker is Tess Moody. Tess lives on an organic dairy farm in a small town in the far northwest Tasmania, and identifies as a non-binary person with disability. Tess is an intersectional advocate and is passionate about elevating the voices of people with disability, the LGBTIQ community, and survivors of all forms of violence. Tess has a professional background in counselling, but currently works part-time as a project coordinator in the primary prevention of family violence and as an LGBTIQ community support worker. Tess is the creator of a Facebook page to support autistic girls and women and those who know and love them, called Neurodiversity Goddess. They also run a Facebook group for over 2,000 people with Ehlers-Danlos syndrome. Sorry if I didn't pronounce that correctly. And provide relationship and sexuality support. So welcome, Tess.
Thank you, Heidi. Hello, everybody from down here. I'm really excited to be here today. I'll be using notes because if I don't, I'll get off on big rants and I'll go well over time. So it helps to keep me within some structure. I guess speaking to the biggest issue that I've faced as a woman with disability living in a rural area, it would be the access to appropriate and consistent healthcare, including special. where I live on the far northwest of Tasmania, we only have a very small rural hospital, have any resident doctors in place, and we just have one GP service to service around 8,500 people in my area. We lost around half of our GPs last year, which created a bit of an issue, and the gap's been filled with locums. There's a bit of an issue with that we have to wait sometimes long times for an appointment. Some of the more established GPs don't take on new patients, and there can be really poor consistency of care or follow-up with any testing or imaging. This creates issues for me with Ehlers-Danlos syndrome. Heidi did a really good job pronouncing that, because it creates multiple issues for my joints, tissues and organs, and I'm also managing over a dozen diagnosed conditions with that. Without a regular GP that's consistent, I find that I don't visit the doctor when I should in a timely manner, and I often don't go until things are pretty serious. Our closest hospital that can actually deal with things that are more acute or serious or do surgery is about 3 hours return drive for me, but most of my specialists are between 7 hours and 12 hours return drive to see, and that can be really difficult for me to make those trips with the joint dislocations, chronic pain that I have. We also don't have any resident psychologists, physiotherapists or OTs that live in our area. They're all visiting from outside the area to treat the conditions that I deal with. So that's a 2-hour return drive for me. If I'm wanting consistent healthcare, I really have to travel to go and see them, and I need specialist care because of the condition that I have with EDS, and also for autism. There aren't any specialists here in my rural area that specialise in that. How I try to manage that is I will book my appointments so that my partner can support me by coming with me, or he can take time off his work to care for our children. But I mostly try and have the appointments during school hours so I can avoid that. I'll try and book multiple appointments in the one place along in the city or over a few days so I can restrict the travel that I have to do and try and reduce cost. But I also try and space appointments between, spaces apart so I don't get really burnt out just trying to make all my medical appointments. I've pretty well much accepted that I won't work full time anymore, that I can only work part time if I can keep the balance between seeking healthcare and also having a job. So that's something that I've grappled with over the years, trying to accept about what my ability is. I can get quite overwhelmed with the amount of travel and appointments that I have to attend. So I guess the thing that I've tried to do the most is stay in the moment, just take one day at a time. Otherwise it becomes really, really stressful. And I have a really cool online diary that I use that helps me structure and schedule everything to try and reduce anxiety. During COVID-19, I've had a mixture of experiences that have been both positive and negative experiences. I've found that using telehealth for my medical appointments was sort of cool because I didn't have to travel as far as what I normally do. So I got really excited about not needing to do all the travel. But unfortunately, most of them were by telephone and not by video link. And being autistic and being a really visual person, I found just having that mode of communication quite challenging. I also found that with EDS, with that lack of hands-on examination by a medical professional, my issues weren't getting addressed properly, and the doctor was relying on me verbally to tell them what was happening rather than being able to examine me. So I carried a lot of health issues through the COVID-19 lockdown period, just sort of waiting for a window when I could get things looked at properly. On the other hand, I've been really pleased to see that the changing landscape of employment, with employers realising and accepting that working from home can be a thing and that actually is achievable and as productive as going into the workplace. So I had the positive experience of picking up 2 part-time jobs with organisations that are actually based in the city at the other end of our state. So that's been a bonus for me. And I work 2 out of 3 of those days from home. So that's really helpful with me trying to manage disability and health. And normally, you know, I probably wouldn't have been offered those positions in the past when we weren't in a more home working focused environment. COVID-19 in general, I'm really passionate, as Heidi said when she introduced me, about raising awareness for women experiencing violence. So I want to talk about that. During COVID-19, we already have to acknowledge that women with disability experience higher rates of family violence, about 37% more at risk of family violence than women without disabilities. The stress and the isolation of COVID-19 has increased the occurrence of family violence for women with disabilities, or intensified that, and it's made it harder for them to reach out for help. Whilst we've been in lockdown, women with disability may be isolated more at home with an abusive partner, with less ability to access the outside support or care. And with a partner at home more, as in working at home or just being at home more during lockdown, a woman with disabilities are less able to even pick up a phone or use the internet to access help because they're not getting the alone space. Also, with less people coming in to your home, that means that there's less opportunities to reach out for help as well. Also, I guess in COVID-19, I mean, I've talked about how I already experienced issues accessing proper healthcare, but during COVID-19, the wait times to see medical specialists here in Tassie or allied health or to access surgery have suddenly really blown out to longer waiting times, because a lot of the medical professionals are dealing with a backlog that the lockdown caused. Here in Tassie too, we also have quite a lot of specialists who visit from Melbourne, so come from interstate. So with Tassie's really tight border restrictions we've had, which has been mandatory quarantine, that's restricted specialists being able to come to Tasmania for many, many months, which I'm hoping that will lift now with our things changing at the end of the month. But that's also resulting in some negative outcomes for women with disability. There was a question about why did I get involved in the disability community. I don't think I ever just woke up one day and said, I want to be involved in the disability community. It just landed in my lap through natural, I guess, progression in my life experiences. I became involved in the disability community more actively as an advocate about 6 years ago, after I was diagnosed with Ehlers-Danlos syndrome at the age of 39. But I came, I guess, more actively involved in disability advocacy after mine and my daughter's autism diagnosis in 2017. I sort of really became passionate then about raising voices. Prior to being diagnosed with EDS and autism, I was already involved in family violence advocacy. But after I was diagnosed with disability and took a lot of time to accept what was happening in my life, my advocacy became more intersectional. Some people might not have heard of the word intersectional before, but that intersectionality addresses that you can be marginalised or excluded across multiple areas within life, such as race, class, socioeconomic status, gender, sexual orientation, disability, or just living in a rural area. So after my diagnoses, I started to probably get a bit of a list of how many of those areas that I've had life experience in or have an identity in. So I just couldn't deny any longer that women with disability are often part of multiple parts of those groups. So my advocacy started to grow on that basis. And I guess being more involved in the disability community came about because after I had my diagnosis, I had a lot of life adjustments to come. I felt quite isolated and alone in my diagnosis, but also living in a rural and remote area as well, where I just felt like I was the only person in the world living with disability. I began connecting with communities online because we didn't really have much here locally that I could connect in with. And that helped me to build a bit of a platform and some confidence, I guess, to feel like I could probably make a difference, instead of, I guess, falling into a place or staying in a place of self-pity and being so disempowered that I had all this extra stuff to deal with already on top of some pretty complex life experiences. Being part of the disability community, and specifically WIDA in particular in the disability community, it helped me build more confidence to be a voice after being involved in the development of their website. That sort of elevated me a bit more to become more passionate about being involved. Also motivated me to be more active in the other communities that I'm part of. I guess what I'd really like to see, I sit at home sometimes and I think, why am I doing this? I've got so many other things to do. I'm tired. You know, I'm a mum, and all of this stuff. But I guess I just really want women with disability to be acknowledged that we are experts by experience, just through what we're living. And I really want to be able to motivate other women and girls with disability to use this absolute wonderful amount of knowledge, strength, resilience, and insights to step up and become a voice. We need more of us. And I feel that if I can do this from my little home up in the corner of Tassie on a little farm, locked away up here while juggling all the complexities of my disability, my health, my identity, and being a mum, then I think anyone can. Thank you.
Thank you, Tess. That was really great. I think a lot of people related to it. There's a lot of people talking in the chat. So thank you very much. We're going to move straight to our next speaker now. Our second speaker is Jody Barney. Jody is a proud deaf Aboriginal woman who is connected to many women with disabilities across Aboriginal and deaf communities in Australia. Jody works as a cultural disabilities consultant and is passionate about improving the voice and visibility of Aboriginal and Torres Strait Islander women with disability. Jody is also currently on WIDA's board and is also a member of the Disability Royal Commission First Nations People Strategic Advisory Group. So welcome, Jody.
Thank you all so much. I have to say, Tessa, what an awesome presentation. I was completely engaged and immersed and just wow. And time just flies, doesn't it? I was completely engrossed in your presentation. Thank you so very, very much. Myself, what's important for me and where I live in Shepparton. So I am regionally based. It's a part of Victoria. I've been home now from February. Oh, hold on. Sorry, they can't see you because it's my voice. Yep, but they can't. So we're having a little technical issue because I think Zoom is voice orientated. It's the interpreter speaking. So Jody's suggesting that if everyone could pin her, that would be great. And then you'll be able to see her and not see the interpreter. It might be helpful if everyone is able to pin me from Jody.
So if you're a panel, an attendee, you should be able to pin Jody by clicking on, there's 3 dots in the top right of Jody's panel. And that should make Jody's video the main video on your screen. Right.
Jody says it depends on if you're what device you're using.
I see.
To watch the Zoom, if you're, and some of the devices don't allow that pinning. Yeah, I'm really sorry. Because of the COVID restrictions currently in Victoria, the interpreters are unable to be on site with me in my home. So I'm not sure what we can do with a tech issue. I'm, well, not that way inclined, one could say, from Jody. We're just all learning on the fly, aren't we, about the technical issues that we face every time we use these platforms. Oh, someone's suggesting that one of the administrators should be able to spotlight me. And they're asking me to unmute. If I unmute, can you see me? Can people see me now?
Yes, they are all saying I can see Jody now. So maybe that was it. Sorry about that, everybody.
Yay to technology. Yay that we had an issue, because I think it's the common norm now, right? Perfect. Thank you. Perhaps you'll be able to hear the signing. Let's see what happens. Lovely. Okay. So I live here on Yorta Yorta country, and the sign for Yorta Yorta is turtle. My heart, everything I breathe really is from Queensland. That's where my mob is. From Hervey Bay, that region is where I'm from, and the Townsville area. So my heart is there, but I live in Shepparton now. So firstly, I guess a little bit about what I do here. I've lived on Yorta Yorta country for maybe 20 years now, I think. Over 20 years probably, in fact. I've lived in Victoria across a number of regions for perhaps 30 years. I have worked in many and various disability sectors. Yes, I have a lived experience, but I've worked as an advocate, and I started working in the community from around 1986. Yes, 1986. That makes me quite old. I appreciate that. Really quite old. So, but really my first experience, well, in the beginning, I didn't know much about disability, my culture, my history, my mob, my family. I didn't identify with any kind of labeling. My family always said, Biriguppa is what they called me, which means my ears are tingling. So B-I-N-A, Bina, means here. And Guri means silly. So my ears are silly. And so that was the name my family always gave me. I was never labelled in a negative way. No one ever put me down. And then when I was about 8, well, prior to that, I really accepted who I was and where I was from. And then I had access to the Aboriginal Sign Language system growing up, and people would just sign around me. It was just part of my life, really. So I had access to information that was important to me. I lived in 4 different worlds, really. My deaf world, a hearing world, my Aboriginal world, and the white world. So very much a mixture of all of those things. And I had to be kind of on an equal playing field in all of them. So really connected to all of them. And that connectivity and that socialization, very, very important to me. What I've missed through COVID life in the regional area is my connection to country. My connection to my family, my community, my responsibilities in that space, my obligations in that space. The work that I do on country, visiting elders, working with the women in my community, welcoming new babies into the family. all of those things have had a major impact on me. First Nations women also, I'm sure you would all agree, it has had a big impact. One way to resolve that is to contact people using Facebook, Instagram, Twitter, email, those social platforms that we now have, text messaging. Also, can you believe they still sell stamps? I've used old-fashioned mailing of letters as well. So anywhere I can. I guess the elders in the community, those who are older, love receiving the paper-based snail mail or a package in the post. The new generation receiving packages in the post have no idea what they are. My nephew's like, what is this? What's going on? My sons are saying, what is this box that's turned up at my door? Anyway, from a professional point of view, I've kept working through COVID-19, visiting those who live locally in the community, who often are very isolated, who are out there on their own, many who don't have other connections with services in the sector, who they trust, who they feel comfortable with. I've provided food hampers, food parcels. I will pick up elders and take them to appointments. We've used video platforms to share Aboriginal Sign Language, to help people in communities that are quarantining, that are isolated, to try and resolve some of those issues as well. I've provided vouchers for personal protective equipment, such as gloves, masks, gowns, face shields, so that families can attend to the care needs that they have. But really, because I also live with a chronic illness myself, I have cancer, that has also had a major impact on my ability to access the health sector. The telehealth system doesn't work very well for deaf people. Video interpreting with poor Wi-Fi connectivity impacts. Sometimes health sectors forget to book interpreters. Sometimes I'm unable to get medication for myself or get medication for elders. The PBS medication supplies are low if they haven't run out. It's really difficult to get medical supplies, which means I haven't been able to access medication on a daily basis in a way that I should. Another barrier that I've experienced is where if I call out to have medication delivered to my home, it's more expensive. The delivery charges are more expensive for me. I have a really good friend who is not Aboriginal. She's paying $7.50 for delivery. I'm paying $16.40 for delivery for the same medication. We live in the same location. Why is that the case? How does that happen? So a lot of First Nations women with a disability accept the cost. I can't really afford it. But really, my responsibility, my cultural obligations continue. It doesn't matter where I live, what I'm doing, or how I connect. I will find a way to connect with people in quite a determined way. For over 60,000 years, we have been working, First Nations women. It doesn't matter how that happens. We have been looking after each other, connecting with each other, regardless of the personal impact that it has on us. With great determination, we make that so. It's my community, they're my elders. I have an obligation to continue the work and to share that obligation, ensuring that through COVID-19, this doesn't put a full stop to the work that we do, that we will overcome it, that we will beat it, and that we will influence what happens. I've really enjoyed working with people from the First Nations community. And through that coronavirus time, I think we've learned a lot, and I really continue to enjoy working with women who have a disability in that space. As elders growing up, we have to show how to roll up our sleeves and get the job done. We have to be proud of the work that we do so we can pass it on to generations to come. Thank you all so very much for attending today.
Thank you very much, Jody. Got lots of support for your talk and a few questions which we will hopefully get to at the end. So now we're going to go to Stephanie, who is our third speaker. Maybe just turn your sound on, Stephanie, so everyone can, just to make sure everyone can see you.
There we go. Can people hear me?
Yep. So
Excellent.
Stevie is our third and final presenter at the webinar, and is a woman with disability who lives with fibromyalgia, functional neurological disease, traumatic brain injury, and PTSD. Stevie lives in sunny Cairns, Queensland, where she works as an educator, advocate, and broker, and is the founder of Empower Me Enterprises and Empower Mortgage and Finance Solutions. Stevie is a strong believer in empowering women and girls with disabilities and is committed to improving the health, well-being, and safety of all women and girls through education and opportunities for professional development. Stevie coaches and mentors women in financial literacy and supports them to develop the skills necessary to advocate for equitable pay, superannuation, and recognition in the workforce. Stevie also worked with WIDA throughout the project to develop the Our Sight website, which supports women and girls with disability to learn and stand up for our rights. So welcome, Stevie.
Thanks so much, Heidi, and I really appreciate that lovely introduction. I also have notes. So first and foremost, I'd like to thank WIDA for this opportunity to speak and talk and share my experience with you today. And I'd also like to acknowledge all the lovely speakers we've had. They were really empowering messages that you were sharing with us today, so thank you. I'd like to thank all those people who have jumped on, and I want you to know that you have so far survived 100% of everything that you've experienced. And that, I think, is tremendous given the challenges that we've faced, particularly this year as women and girls living with disability. Just briefly, a quick recap of my story. Specifically with this year, I actually travelled to both Melbourne and Sydney at the very beginning of March. And I found myself in the ACT after doing lots of travelling, having spent 15 hours on flights and 12 hours on buses. I found myself in Canberra with COVID-19 having just emerged. I was with my family. They live in Gundaroo, which is a rural community about 20 minutes outside of the ACT. And the thing about as I was watching what was happening in the world, my mum used to be a nurse, so I could see, and mum could see what was going to happen next. I realised I had to get home quite quickly because I couldn't afford to be stuck in the ACT over winter. I have a chronic condition, and unfortunately the cold really triggers that. The thing though, that what happened to me was that when I travelled back from my flight from the ACT to Sydney and then Sydney to Sydney to Cairns. When I was on that flight, I got back and I was really, really sick by the time I got to Cairns. The next day I found it very hard to get out of bed, and I had a virus for 5 weeks. I was bedbound. After that I had post-viral fatigue, and I was one of these women in a situation where I'd been dealing with my long-term health condition, and then COVID had erupted. We had hotspots in Sydney with COVID. I had the symptoms of COVID, and I didn't meet the criteria to get tested because I hadn't been in touch with somebody who had been travelling for, been back from overseas within the last 14 days. However, my doctor was concerned, and when Cairns testing became available, she rang me straight away and said, go and get tested. And it was a case of literally the day that she said, go and get tested, I rang them. They said, we're booked out today, come first thing in the morning. So I was tested on the second day that there was COVID testing in Cairns. The experience of this is that right from the start, I feel like I was one of many women and many girls who was ahead of COVID, in that we knew what was coming. We knew our immune systems were compromised, and we had to put safety measures in place to ensure our health and safety and well-being. When I returned to Cairns, I made a point of saying to people, I am self-isolating for 8 weeks minimum. This was before the government was suggesting that people self-isolate. And what I found particularly challenging was that the systems weren't set up in place for people in that early stage who were needing to self-isolate. I feel like the government's tried to play catch up, and it makes sense in one sense, as we've never been through this before. But on the other hand, we have, as women with living with disabilities, women and girls, we have a tremendous expertise when it comes to our own conditions, the things that we need in place to support us during these times. And a lot of what has happened after, from March onwards, is a lot of the systems that have become put in place are actually things that many of us were having to do anyway. So I happen to live with, my partner's a registered nurse, and one of the things I found tremendously helpful was I had someone who could be that support person for me. When I was self-isolating, I was in bed for 5 weeks. I then had almost a month of post-viral fatigue. I had 2 friends that died during COVID. One very tragically suicided, and the other one had died of breast cancer. It was incredibly challenging trying to get my healthcare needs met in a place like remote Cairns. So I'm in a remote area. And one of the things I found was that I really had empathy for people who didn't have a support person with them. It really made me wonder how on earth would I have gotten through that period of time when I didn't have someone who could pick up medication for me. I didn't have somebody who could help me get to the bathroom when I couldn't walk. It made me really aware of this. And unlike some people where their experiences of telehealth and InstaScript haven't been particularly helpful, in my case, I think these things were absolutely fundamental. I was in a situation where telehealth was what I needed. I needed to be able to access a doctor from my bed, essentially. I needed to be able to access a counsellor from my bed. And one of the things I learnt through this too was that my healthcare practitioners, they were trying to catch up as well. And I remember one particular incident where I had cried the whole time on the phone to my counsellor because I had developed a prolapse disc in June, and she wanted me to, she basically wanted me to go and get my scan for my back, and then she wanted me to get my card for payment. And I had to say to her, I'm in bed, I can't move, I can't get my handbag right now. That was something that for me, I realised was that lack of them trying to play catch up, them trying to work with their clients. It wasn't until the next session that I said to her, look, I was really upset by the fact that I couldn't walk, and then you're asking me for payment. And she said, I'm so sorry. She said, I literally had to say to myself, I had to change my systems because I'm so used to asking for payment. And when this changed and we went on to telehealth, I had to change my system. But having that shared conversation really gave me empathy for the fact that our treatment professionals are having to play catch up too. Usually I set a timer, and apologise for this. This time I didn't do it, but was that the bell, literally, that rang? Did someone ring the bell?
Yeah, so if
Yep.
you just finish
Okay.
up.
So what I might do, because I do have some more things to say, I might put those together and make them available to Heidi to share. This is the first time I've done a platform like this, so and I really want to honour the time that I've been given and not go over time. But what I'll do is I'll type all these notes that I have up. I just want to let people know too that as of yesterday, Medicare became available for mental health and an extra 10 sessions per year, just as of yesterday. So if you've already used 10 sessions on a mental health care plan, you have an opportunity to get another 10 if you have a mental health care plan, which I think is really necessary right now for people to protect their mental health. I'll stop there and I'll put this together, and anyone who'd like to access it, please do. Thanks so much, Heidi.
That's okay, thank you. We are going to go to questions now, so we may be able to cover some of what you were going to say in those.
Sure.
So there is one question in the Q&A, but I'm going to start with a more general one for all of you. So essentially, we've all talked about, you've all talked about things during COVID-19 and how it was hard for yourselves and women with disability as a community. I just wondered if any of you or all of you have tips that you can pass on to other women and girls with disability who may be struggling on, I guess, how you stayed positive through the COVID-19 pandemic, or ways, things you use to cope. So anyone can go.
I can go. I think the most important thing to do is reach out to other people in whatever way you can, by social media, by phone, just whatever way you can, to reduce that extra sense of isolation and anxiety. I know when we were in lockdown, I remember just going to an absolute survival mode and to decide what did I need for my physical and my mental health. And I noticed that the strongest supports that I had around me were people I reached out to on social media or via text. So I feel that's really important, particularly if you're living in rural. The extra isolation you're going to experience can be quite negative to your mental health. So reach out.
I would add to that, I think that's fantastic. I think it's really important to know that you are the expert when it comes to your health and managing any conditions. And I think that having these open dialogues and not being scared to have these conversations with treatment providers and actually say what it is that you need and what would help you. I think that the government has, we have a remarkable capacity as women and girls living with disabilities to help keep these things in place that some women have really benefited from because of COVID, things that shouldn't drop off once the country recovers. I think it's really necessary that we keep some of these services up and running to empower more people, more women and girls living with disability.
Thanks, Stevie. Do you have anything to add, Jody? Yep, so.
So I'd just like to add that I agree with all the other women on the panel as well. So making sure that we have access to what we need and more accessibility to counselling and access to networking, who can actually give us that strength that's really, really important. So I just wonder, like, also cultural needs and making sure that people feel that they have that connection. So for example, for me, walking on country and walking along the river and things like that, or going to the beach, having salt water. At the moment, I can't do that. I can't be near the water. So I can't be near the I can be near the mountains and the river, but I can't be near the salt water. And that's what I have, that spiritual connection. So making sure that you're doing things that you enjoy. I love cooking, so it helps me with my mental health. So being positive and benefiting people and giving people food hampers and things like that, it sort of makes me feel good. So doing those things that make you feel good, the things that you're passionate about, and making sure that you are kind to yourself and to each other. So, and making sure that we have that connection with each other and not feel we need to be able to accept any criticism, because you don't know what other people out there are feeling as well.
Yeah, thank you. We did have a question specifically for you, Jody, as well, I think. So that came up earlier when you were talking. And Lynn has asked, have support services and self-determination changed? Have they changed much since you started back in 1986?
Wow, definitely changed. Yes. I think really what I've seen is the benefit and the strength that's happened in the advocacy sector, that the work has grown, that First Nations people has grown. They've grown, and the advocacy work has grown. There are a few wonderful women that I've met that are amazing advocates. Way back when that was the case. I think now that First Nations women, there are more of us. First Nations girls who are growing with encouragement from the women, from the elders. And I think that's helpful in self-determination. And I think we have to keep advocating. We have to be quite determined about the work that we do and setting it up well for the young women. So yes, changes. Sometimes the change is slow to occur for the better, but we have to keep keeping it on. I think that if we ask for expedient change, it doesn't last. It's not done well. It's not done properly. I think to yarn with our mobs, to do it in a culturally appropriate, a culturally sensitive way, to ensure that our voices are heard appropriately. I think First Nations women, First Nation girls really need to have that opportunity to yarn, to engage with mentors, to have elders share their wealth of knowledge and experience, and to support each other.
Thank you, Jody. So now we've got another question that's a more general one for everybody, and it is, are there any other services that you are aware of to support children with disabilities that can be accessed online or remotely?
What was the last word? Sorry.
Okay.
That can be accessed online or remotely.
Oh, remotely.
I can suggest one that I obviously have engaged in because I'm not a child, but it has been mentioned a few times, so it's probably worth sharing. And it's called Livewire, livewire.org.au. I've just pulled it up in front of me so I can read the little spiel they have. It's a free online community connecting teens living with illness or disability and their siblings in Australia and New Zealand. They have a moderated chat that's live from 12 p.m. to 12 a.m. every day, plus live streaming games, videos, comps and more. I don't know the person who asked the question whether you specifically mean young children or teens, but something that's being used a lot for teenagers and young people also is Discord, that can connect people together, also particularly in online gaming space. So I don't know if that's helpful, Jasmine.
I think there's also a lot of opportunities now through schools as well. I'm a registered teacher in Queensland, and I know that there are some fantastic resources that have been pulled together for teachers and for parents. A lot of the schools are offering online training, covering different aspects to support children, in terms of mental health support, in terms of learning support, in terms of dealing with change support, in terms of technology, some of the safety issues with technology and learning online. So I think a good place to start is also the school communities.
Yeah. Okay, thank you. We might move on to another one just in the name of time. So there's another question that is, there still seem to be barriers, like the one mentioned about the difference in delivery fees. I'm not entirely sure if that's referring to services or something else, but if anyone has any comments on that, please go ahead.
I would be asking why there's a difference in service fee. I've recently had to ring and speak with my chemist because I kept having differences in medication prices, and I wanted to know why. And one tip I will give people, you actually have to specifically ask for, if you want the cheapest medication, you actually specifically need to ask for it to be price matched. I didn't think this was the case, but because of different pharmacies being private companies, if you ask that, they usually have to make, they need to check and they have to make that match. If you don't ask, you'll get given a higher price usually.
Okay, thank you. So there's one more from Sue Farnham, who I think it's for you, Tess. How did you get an autism diagnosis as an adult? And it's quite a personal one, so you don't have to go into any detail if you don't want to.
That's fine. I get asked this one quite a lot, so I'm okay to answer that. My autism diagnosis came about when I was having my daughter assessed, and all the questions were being asked of her as a child, and me in my own head ticking off all the boxes to how familiar that sounded to me as a child. So had our assessment diagnosis all around the same time. I did have struggles here in Tasmania finding a psychologist who was experienced or versed enough in adult women with autism. So that took me a little bit of poking around, and I actually had my assessment done by a psychologist from interstate. So it really is just, if you want an assessment, is working out where in the area that you live that somebody could do that assessment or diagnosis for you. And I can't comment because I'm not sure where you live, but if you want to talk a little bit more about that to me, find me through Neurodiversity Goddess on Facebook, and I'm happy to chat some more.
Great, thank you, Tess. Okay, so now we might move on to a summary, and Tricia, the WIDA president, is going to do that for us. And I noticed someone also asked in the question and answer, does WIDA connect with the education department and or schools so that girls and their families are aware of what you do? And I thought, Tricia, you might be able to have a go at answering this in your finalising summary as the WIDA president.
Well, I don't know whether I can answer that one because I don't get into the operational, because I'm the president, which means I do governance, which means I set the direction. But I can assure you that our CEO, Carolyn from ADA, is everywhere on every issue, and certainly talking about education is one of our key platforms, inclusive education. So that might be something we might follow up later, Heidi. Thank you. For me, this has been amazing. We have had 3 wonderful panellists. And to me, it's about the commonality of women's experience, the commonality of women with disabilities experience, but the added impact of living in a rural community. It was interesting to me to listen to you talk about COVID-19 and how we know our bodies and that we get out of the way early. So I've been in lockdown since March 13th. I live in Melbourne, and we are in a dangerous place for women with disabilities. My health means that if I catch COVID-19, I will die. Simple as that. So I just don't go anywhere. And I made that decision myself. And I've actually coped quite well with it because I'm adaptable like our other women are. The cost for women with disabilities can be high, not only in medication, but in social isolation, but also in acceptance from the rest of the community. And I think that's something we need to think about. How we manage our lives is done with care and forethought. It's interesting that there have been a few benefits from COVID-19. For myself, I've been working overseas for the past 2 weeks in Asia and the Pacific Rim, and in Myanmar and in Glasgow. And I haven't left home, but I've still been able to do that and make really strong connections with women with disabilities around the world, and the issues are the same. My business has grown because I'm able to work from home. I'm saving 3 hours a day in travel time because I'm able to work from home. So there are so many things that have been beneficial to me, but I've noticed that for women with disabilities, the ability to work remotely has meant that I don't have to travel into the city to do a job. I've been running an online entrepreneurs program. We were going to do it face-to-face, but it's actually suited women with disabilities much better to do it remotely. They don't have to worry about finding childcare. They don't have to worry about taking 3 days from home to travel in the city to do a course. They can do it from the comfort of their home. We are adaptable. We have the ability to lead and lead well. So thank you, everyone. I hope you've all achieved so much from listening to our 3 expert panelists, 3 different women, but with commonality, which is an ability to get through no matter what. So thank you very much. And thank you all the attendees for coming along today. Thank you.
Great, thank you, Tricia. We are going to finish up now, but I noticed someone has asked, and yes, we will. We have recorded this session, and it will be put up on the WIDA website and the National Rural Women's Coalition website, and we will share that on our social media as well. So thanks everyone for coming.